No more polio. The poliomyelitis virus causes poliomyelitis, referred to as polio, also known as poliomyelitis, infantile paralysis, also translated as acute gray and white myelitis. It is caused by the polio virus and can infect humans. About 90% to 95% of infections do not cause any symptoms. The remaining 5% to 10% have mild symptoms such as fever, headache, vomiting, diarrhea, stiff neck and pain in the limbs. These symptomatic patients often fully recover within 1 to 2 weeks. Only about 0.5% of patients will have weakened muscles, causing difficulty in movement. The course of the disease may take just a few hours or may take days. Muscle weakness often occurs in the lower limbs and rarely in the muscles of the head, neck, and diaphragm. Most people can recover on their own, but a few will be permanently disabled. Among patients with weakened muscles caused by infection with this virus, 2% to 5% of infants and 15% to 30% of adults will die. It takes a long time to recover from post-polio infection syndrome, and you will have the same muscle weakness as during the infection period for a long time. The disease not only affects children, but adults can also become disabled due to infection, such as Thomas Midgley, the American chemist who invented tetraethyl lead and freon, and Franklin Roosevelt, the 32nd President of the United States. The polio virus is usually spread through feces or mouth. It may also be transmitted through water or food contaminated with feces. Transmission through saliva is less common. People infected with the virus may still be able to spread the disease even if they have been asymptomatic for 6 weeks. By finding the virus in the patient's stool or finding the corresponding antibodies in the blood, it can be used as a basis for diagnosis of polio. Polio infection can be prevented with the polio vaccine, which is available as oral drops, sugar pills, and injections. However, in order for the vaccine to be effective, multiple doses must be injected, taken continuously. The U.S. Centers for Disease Control and Prevention recommends that travelers and residents of countries where polio is still endemic should receive additional polio vaccinations. Once infected, there is currently no specific medicine or treatment. The number of polio infections has dropped from 350,000 in 1988 to 416 in 2013. Polio has existed for thousands of years. In 1908, the Austrian physician Landsteiner was the first to identify the polio virus. Large-scale disease outbreaks began in Europe and the United States at the end of the 19th century. In the 20th century, polio became the most worrying disease among young children in epidemic areas. In the 1950s, American virologist Jonas Salk produced the world's first polio vaccine. It is hoped that through the implementation of vaccines and early detection, the WHO in 2013 predicted that this disease could finally be eradicated from the world by 2018. In 2013, several new cases were discovered in Syria, and in May 2014, the WHO declared an international public health emergency due to polio outbreaks in Asia, Africa, and the Middle East. Clinical manifestations. The most obvious characteristic is that after the stable period, progressive muscular atrophy, decrease in muscle mass occurs, limb weakness, pain and fatigue, decreased ability to carry out daily activities, and attenuated upper limb function and lung function. As the disease progresses, various deformities gradually appear in the limbs. Early deformities can be corrected, but in the later stages of sequelae, paralyzed muscles no longer recover, and muscle fibers gradually atrophy, become smaller, or even disappear. Due to muscle atrophy, imbalance of muscle strength and weight bearing of the body, tissue contracture and bone and joint deformity occur. Common deformities include joint contracture, bone and joint deformation, clubfoot, foot valgus, knee varus or valgus, pelvic tilt, scoliosis, shortening of the lower limbs, etc. Tendon reflexes weaken or disappear.